Hypertrichosis causes a human to have abnormal hair growth covering their bodies. Faces in particular can be completely covered in long hair, hence why the condition has earned the nickname of werewolf syndrome. The condition can be either congenital or acquired, with those born with it subject to several genetic mutations. Those who get the condition later in life can acquire it as a side effect from anti-balding treatments, while there are some who do not have an obvious cause. Contact with cold air or water can trigger a histamine reaction for those with cold urticaria, similar to an allergy to peanuts or bees. Skin that has been in contact with cold develops reddish, itchy hives. Those who have severe conditions can experience extreme swelling of the throat and tongue, which can be fatal. Swimming in cold water, for example, can lead to very low blood pressure, fainting, shock, and even death. It's yet to be discovered what causes this condition, but treatment for cold urticaria usually includes taking antihistamines and avoiding cold air and water. Exploding head syndrome is a form of hypnagogic auditory hallucination and is a rare and relatively undocumented parasomnia event in which someone experiences a loud bang in their head, similar to a bomb exploding, a gun going off, ringing, an earthquake, or any other form of loud, indecipherable noise that seems to originate from inside the head. Even though it does not cause physical pain or swelling, the symptoms are alarming and disruptive. Some people have it once in their entire life, whereas some people have it up to 7 times per night, says Dr. Brian Sharpless, director of the psychology clinic at Washington State University. He says the condition is likely brought on by insomnia, general sleep disruption, and certain types of anxiety. Alien hand syndrome is a rare neurological disorder that causes hand movement without the person being aware of what is happening or having control over the action. The afflicted person may sometimes reach for objects and manipulate them without wanting to do so. It's believed to be caused by a rare side effect to brain surgery or brain injuries. To date, there is no cure for this condition, although the symptoms can be managed by ensuring the hand is actively engaged in activity. Elephantiasis comes to fruition through a symptom of a variety of diseases, where parts of a person's body swell to massive proportions. This is because of the obstruction of lymphatic vessels, which causes extreme swelling of skin and tissues, typically in the legs or testicles. One of the leading causes occurs via parasitic worms passed on through mosquito bites, which isn't uncommon in tropical regions and Africa. In some parts of Ethiopia, up to 6% of the population suffers from the disorder. Over 40 million people have been affected by this condition. Water allergy is a rarely diagnosed form of physical urticaria. While it isn't a true allergy, as it doesn't trigger a histamine response, there are some who develop itchy hives after minutes of water exposure. The cause isn't well known, but one theory is that specific chemicals or impurities that are present within water is why it occurs. However, even purified water can trigger a reaction. Around 1 in 1 million people have vampire syndrome, a condition that makes you extremely sensitive to the sun's UV rays. If exposed to sunlight, it'll lead to extreme sunburns and breakdown of the skin. Without proper protection, nearly half of all children with XP develop some type of skin cancer by the age of 10. The eyes can also become bloodshot, hazy, and irritated from UV exposure. The tree man illness is an extremely rare autosomal recessive genetic hereditary skin disorder associated with high risk of carcinoma of the skin. Uncontrolled HPV infections result in the growth of scaly macules and papules, particularly on the hands and feet. Although there's some treatment options available to alleviate the symptoms, there is no cure. FOP turns soft tissues into bone over time. The progressive genetic disorder turns skeletal muscle into bone and causes joints to fuse together. It occurs in around 1 in 2 million people with no cures. Attempts to surgically remove the bone results in more robust bone growth. There have approximately been 700 confirmed cases across the world from an estimated 2,500. The Cotard delusion, also known as Cotard syndrome and walking corpse syndrome, is a rare mental illness in which the afflicted person holds the delusion that he or she is dead. The condition is connected to dysfunction in the areas of the brain responsible for recognizing and associating emotions with faces, including their own, Consequently, this causes a complete emotional detachment and removes the sense of personal identity when looking at their bodies, to the point where they feel they're missing body parts, such as the brain. Many who have suffered from the condition in the past have died from starvation, as they believe they don't need to eat, since their state of mind is that they're dead. Graham Harrison, who had attempted suicide by taking an electrical appliance with him into the bath, and awoke in the hospital believing he was dead, is the only patient with Cotard's delusion to have undergone a PET scan. What doctors found was unsettling. Dr. Stephen Lauries, a neurologist at University of Liège, said, "Graham's brain function resembles that of someone during anesthesia or sleep. Seeing this pattern in someone who is awake is quite unique to my knowledge. I've been analyzing PET scans for 15 years, and I've never seen anyone who was on his feet, who was interacting with people, with such an abnormal scan result." One thing's for certain, the walking corpse syndrome illustrates just how little we still know about the human brain in the 21st century.